The healthcare industry in America leaves so much to be desired. Medical debt is increasing, billions are lost in unpaid claims, hospitals are in the red, service prices can range up to 30x. But that's not all.
Nobody knows the price of healthcare. When we say nobody, we mean nobody.
It's unaffordable, opaque, and it's becoming a leading category for viral memes as a result.
Around 50% of every dollar that is being invoiced is being uncollected. That's unheard of.
Healthcare, broadly known and understood to be among the worst consumer purchasing experiences.
We have definitely talked to some clinics where if they don't get paid 1 month, they literally can't make payroll.
What is actually being unwound is the backbone of healthcare for a very large portion of the country. And so I think it's going to just blindside and surprise a ton of people.
As part of this short 6-video series on the emerging intersection between healthcare and fintech, we talked to the founders trying to modernize the $4 trillion healthcare industry, together with the help of fintech. As a reminder, the content here is for informational purposes only, should not be taken as legal, business, tax, or investment advice, or be used to evaluate any investment or security, and is not directed at any investors or potential investors in any A16Z fund. For more details, please see a16z.com/disclosures. Some of the biggest changes to Medicaid in years take effect in 2023. Starting April 1st, states began removing millions of people off of Medicaid's rolls as a pandemic-era program that kept them enrolled expired. Most states are expected to take between 9 months and a full year to complete the verification process, but here is the craziest part. Most of those people about to lose coverage don't even know about it yet. Here is Jimmy Chen, founder and CEO of Propel, a company building software for low-income families who use the social safety net, discussing how millions of Americans are about to be in for a terrible surprise.
You know, the most pressing issue that I see is actually one that's happening this year. It's that there are between 5 and 14 million people that are expected to lose their Medicaid coverage once the COVID public health emergency officially expires in May. That is going to leave millions of people without healthcare. And so while experts and policymakers are calling this the unwinding, which is kind of this terrifying term, when you think about it, what is actually being unwound is the backbone of healthcare for a very large portion of the country. There's a survey published last year by the Robert Wood Johnson Foundation that found that 62% of Medicaid members, or those with family members enrolled, said that they had heard nothing about future Medicaid redeterminations. And so I think it's going to just blindside and surprise a ton of people.
This lack of information stems from the fact that there aren't enough companies building software for low-income communities. Why? Because founders tend to solve problems that they experience firsthand. And founders often aren't the ones relying on the social safety net. Instead, it's the families who are living paycheck to paycheck. And as a result, there is this huge opportunity for companies to build software for this underserved demographic. And that's exactly why Jimmy started Propel.
Yeah, I was previously a product manager at Facebook, where I led the Facebook groups team. Before that, I was a PM at LinkedIn. But before that, I was a little kid who grew up in a loving family that also had some financial challenges. And so after going to college on a financial needs scholarship and learning how to code, I spent a lot of time thinking about who tech entrepreneurs are, especially in consumer software, where people building things that are used by millions. And that there's this common wisdom that people who start tech companies generally solve their own problems. That to me was one of the core explanations for why the tech industry was so tilted towards solving the problems of the middle to higher income parts of our population. And so, the kind of secular trend that I thought was really underappreciated was the fact that in this day and age, essentially all low-income Americans have access to a smartphone and access to a data plan. That people are native users of the internet, they're comfortable using apps, they're comfortable putting their information online, they're comfortable, navigating all sorts of different processes and programs through their phones. It just was that there were way fewer companies thinking about building world-class experiences for low-income families in particular.
Though progress has been made, the lack of awareness around recent changes in Medicaid shows that we still have a long way to go. But Jimmy hopes that one day things will look different, and that millions of low-income Americans will have instant access to critical healthcare information.
I would love America's safety net to be a place where you can sign up for one thing and then you should get all the things you qualify for, right? The single sign-on for government benefits has been almost a white whale in this industry that is really, really difficult to do because of just the bureaucracies and the siloing and the fact that everything's run by a different type of organization. But I think it's actually within reach in many ways to get closer to that kind of single sign-on experience where somebody applies for, qualifies for one program, and then we can easily connect what are the other things that person might qualify for and might be able to utilize because of their existing enrollment in that first program. And that I think, for this to really succeed, it needs to go between programs. So you might qualify for a program like SNAP focused on food purchasing, but that has clear implications on public health and on individual health. And so that determination really ought to be able to also say, and this person, not only qualifies for Medicaid, but also here are the 5 things that they should get without further sign up, without having to provide more information.
So what do you think? Can we rebuild this broken system? Where do you see the biggest opportunities for disruption in healthcare? Let us know in the comments below. And if you like this video, be sure to check out our next installment with Firefly Health, a company trying to Marie Kondo the healthcare system through value-based virtual first care. And if you'd like to learn more about how fintech is revolutionizing healthcare, head on over to a16z.com/healthcare-meets-fintech, or click on the link in our pinned comment. Thanks for listening to the A16Z podcast. If you like this episode, don't forget to subscribe here on YouTube to get our exclusive video content. We'll see you next time.